Actually, while I see the Governor, Peter Nyong'o is here, while we're working on getting our the IT guys to get this to work here, I'm going to just, if you don't mind, ask the Governor to come up and maybe say a word or two, just to kick off the symposium this morning.
Yes, if you're ready, give me a few minutes, then you ask the Minister for help.
Minister for
help. Yeah.
We're ready.
You're ready?
Okay.
Call the Minister.
So we will start off with the Minister of Health, please. Thank you.
The Governor, Great County of Kisumu, Professor Peter Anyang, the neurosurgeons, support staff, the guests, good morning. Good morning. This morning I was with you yesterday, and I opened the symposium on behalf of the Governor, and I told you that he had some engagements yesterday, and I promised that he will be here today. So we are happy to have our Governor here today. So, Governor, these are a team of neurosurgeons from various parts of the country. They arrived last Sunday, and they have been conducting surgeries. So by yesterday, I think by yesterday they had done slightly above 23 surgeries. And this symposium started yesterday, whereby they are sharing ideas, looking at unique medical cases and taking views from each other on what they can do if they were faced with such situations. So without much ado, I take this opportunity to invite our Governor to come and address you. Karibu, Governor.
Good morning, ladies and gentlemen. How are you? Are you enjoying Kisumu?
Yes.
Anything I can do to make you enjoy it? Welcome you to Kisumu and welcome you to this workshop or symposium, neuroscience symposium here in Kisumu. I've been following closely in the last couple of years your annual work here at Jaramogi Oginga Odinga Teaching and Research Hospital with a great deal of appreciation, to tell you the truth. And I see that the numbers are growing. We were with Victor War. Where's Victor? Yeah, sure. During the last one. And my friend Dr. Oluwacho during the last thing at Jaramogi Oginga Odinga Hospital, and I saw what was happening. Of course, not being a doctor, I was very fascinated to see how people are opened up and all kinds of great things done. And then the next day I met an old man from Moroni who had not been walking before he came, and he was sitting in his bed and he was appreciating the movement of his legs. He admired the transformation. It looks as if Jesus has come back again to raise the dead from their slumber and the disease set free from their diseases. It is really something wonderful. But I'm here really today to first apologize for not having been here on Monday with you. I was in Cairo for yet another meeting, which is important for our country. And then when I came back with a series of meetings, I was telling Dr. Oluwacho there on launching universal healthcare here in Kenya, which is a really great thing. The president is very concerned about how things are moving. So we've been locked up in Nairobi for the last 2 days, just trying to decipher what we need to do. Well, let me say the following. One, that this neurosciences initiative is probably going to transform what Jaramogi Oginga Odinga is doing, because we have a lot of problems that are related to neuroscience. You now understand it better. I see it in terms of the number of patients having neuroscience-related problems from the dispensary to the health center to the sub-county hospital up to the county hospital, the reforms such as the Jaramogi. And what universal healthcare is trying to do now is to make sure that as people go up the ladder referral, that there's capacity at the lower levels to do diagnosis and also to refer people up to Jaramogi Oginga Odinga Teaching and Referral Hospital who really need to be there. So that the work of Peter Okoth there is not complicated by cases that can be solved at the lower levels of medical care, and that the likes of you are not very many in this country. I think, if I'm not wrong, there are only about 20 neurosurgeons in the whole republic. Am I right?
It has since gone to 13.
Oh yes, in the last couple of days. The data I knew is that we are only 20, but you know, if you have 20 neurosurgeons that count to 50 million people, that's quite a burden to the 20 that exist. And therefore, coming here and beginning this kind of work, and your presence alone encourages those people who aspire to be neurosurgeons to do something, to take up the responsibility. So, from a purely practical point of view, what I've seen of the cases we're dealing with in implementing universal healthcare, the data that we're having before us, why it is that we should strengthen the capacity of lower level health facilities so that the need for especially the higher level is not overburdened. That's right. So being here this week and doing this work, in that regard, is very important for us. Secondly, holding this neurosurgery camp at Jaramogi Oginga Odinga and Referral Hospital for the third or fourth time? The fifth time. Really is good, and I hope, and I would like to appeal to my colleagues here in Kenya, like Dr. Rochalunya, that you keep on the tempo, and that more and more people come. The reason why I would like to appeal to more and more people to come is I hope when you come, you're from Britain to the US and so on, you make a decision to stay. Or to come back more often. I think a mechanism can be established where you come back more often and join us in what we're doing so that we can benefit from your specialization or specialities. We in the county government, since health is devolved now, are very ready to facilitate and support what can make your coming back much more productive for our people and for yourselves. Thirdly, the ongoing camp, as I understand it, targets to have managed about 85 patients over an intense period of hardly 1 week. And that to me is really commendable, because just think of the number of people who go without having access to neuroscience and neurosurgery in a year in a country where we are near 20. If you can see 85 in 1 week, I think we are doing extremely well, and I must commend you for that. I want to sincerely thank Dr. Woor and his team of neurospecialists from the United States of America, our locally based specialist, Dr. Lunya, and Peter there and his team at Jaramogi for being hosts to this seminar, and really working very systematically throughout the year to make sure that this symposium is a success. I do believe that when you go to Jaramogi Oginga Odinga Teaching and Referral Hospital, you will notice that it doesn't really have those conveniences that you may have in your own facilities. But we're working very hard to modernize Jaramogi. It was built many years ago in early 60s. It's like a fort, the walls are very thick, and I don't know what we're defending ourselves against. But that fort has a lot of space in it. And we want to make sure that the space is optimally used, and that other services that are not there that should complement what every department or every specialization in health in there is supported by ancillary services that are necessary. This symposium, therefore, comes at a very critical time in our development at the Jaramogi Oginga Odinga Referral and Teaching Hospital, in our development as a nation. Now, that teaching hospital is used by two universities, Maseno University and Uzima University. Can I see by a show of hands, Amalu, and combining S and SH is not easy. I could even say, can I see by a show of hands? But can I see by a show of hands how many people from Maseno are here? Don't be shy, just put up your hands, like a man or a woman. Up to heaven. Thank you very much. They got a number. How many are from Uzima University? Uzima is not really present here. But let me stick to Maseno, since we have a number of people here. I think at Maseno University, medical school, you really must aim at being the avant-garde medical school in the nation, because you can do it. You are in an environment where you don't lack the raw material for your work, i.e. diseases exist in plenitude. I was talking to my friend Dr. Charles Otieno, who is spearheading the establishment of a sickle cell center at Jaramogi. And he told me one of the reasons why his colleagues in the US support him in that initiative is that if you have a sickle cell center here, you don't lack patients. They are there in plenty. If you have it in Los Angeles, there are not that many. So it's better to have a sickle cell center at Jaramogi Oginga Odinga Hospital where the raw materials are available. I'm sorry to call patients raw materials, but I think in economics, resources like those are called raw materials. So exist, and so you don't lack what you need to exercise your science on patients. Now, one of the reasons why Kisumu was chosen as a pilot county for universal healthcare is because indications of maladies and pathologies and so on were quite plenty here. I'm sorry to say so, but that's the reality. Not that we are that bad, but by coincidence in history, there are certain diseases like malaria, HIV, AIDS, sickle cell, and so on, which do exist here. So if you're going to have universal healthcare and you're taking samples of counties where you trialed a pilot project, you take Nyeri where hypertension is highest in the country, you go to Machakos where they have all the old, but I know of ours. So when you look at that and say, look, Maseno University, that's medical school, you are challenged by the nation that you must spearhead the health revolution in this country through scientific research publications and academic leadership. I think we must go past the era when people are in universities with one leg and a bigger leg is outside purely for business. We will not get very far. I think this is a challenge that we must face in this time, at this time in history. And therefore, if you have a symposium like this, it really warms my heart because I know we are going the right direction. I know we are reaching out to the international community to share our medical knowledge, our experiences, so that we don't only add to their own knowledge because of all the experience here in terms of research output, but we also gain from what they have achieved in terms of technological revolution in health delivery systems. And I will tell you that having visited some of those medical schools in Chicago, in San Francisco, in Los Angeles, in Washington, the technological revolution to deliver healthcare in a much faster and accurate way is amazing. And I hope that when we have this neuroscience symposium, Dr. Lunya, we will come out on knowing that the certain things we thought we couldn't do, we can now do because we can communicate very easily with our colleagues in Lisbon, in Paris, and in Buenos Aires, and in Washington, at real time. I hope you know what I mean by real time. You know it better than I do. And I think so, incorporating this technological revolution, because we have our colleagues here who have practiced under such circumstances for a long time, perhaps maybe the outcome of this neuroscience, and we enrich Maseno's capacity to become the leading medical school in Kenya, the way other universities elsewhere boast themselves that they're leading medical schools in this or that branch of medical science in other societies. As we say here in Kisumu, we want to stop walking with a chicken to fly with the eagles. And that is why our team, which was established just a year ago, Kisumu All Stars, is now going to the Premier League just for 1 year, because because they knew they had to stop walking the chicken, walking with the chicken, and to begin flying with the eagles. And finally, we have a slogan here in Kisumu County, which is called Teach Tire, which means work is being done or work is going on. Somebody said, try to pronounce it and say teach tire. But it should be teach tire. So when I say teach tire, you reply teach tire. Teach tire!
Teach tire.
Asanteni sana. Thank you very much. I now declare this symposium open.